Hello everyone, this is Dr.P.Iswarya Devi M.D. Siddha. So today let's see what is asthenospermia, and many people are worrying that because of asthenospermia they couldn't get naturally conceived and IVF is the only solution, but it is not so. You can get it cured through Siddha medicines and within 45 days. So what is asthenospermia? Asthenospermia is the low motility of your sperms. So actually, motile sperms should be at least 80% in your semen and 20% can be dead sperms. So more than 20% of dead sperms also indicates that it is asthenospermia. Your total motility indicates both progressive and non-progressive sperms. Non-progressive sperms are live sperms, but they do not show any movement, so they are useless in making a natural conception. Your total motility, that is your progressive motility, should be at least 40%, and which active motility should be minimum of 30%. So if there is any lower count in this percentage, then it indicates that you are having asthenospermia. So many people worry nowadays that because of asthenospermia, that is low motile sperm, they could not get naturally conceived, and many doctors insist them to go for an IVF. But this is not at all necessary. You can cure this through Siddha medicines in 45 days. So there are many patients who come to our clinic and get it cured in 45 days. And in this video, I'm going to show you a few examples of such patients who showed a good improvement in 45 days itself. So the first patient is Mr. Rajendran. He came to us with just 0 to 2 sperms and with the motility of C and D grade. The C and D grade indicates just non-progressive and dead sperms only. Okay, he had just 0 to 2 sperms which were non-progressive and immotile. So after 45 days of treatment, he got nearly 50% of rapid motility. You can see this in his video, in this report. He got 50% rapid motility and the sluggish motility was 10. So total progressive motility was 60%, which is a good motile percentage, which is natural, which is possible to get naturally conceived. So this is the first example. Another patient, Mr. Vignesh, had just active sperms of 3% before treatment, and he had just a few sperm count up to 1000 per ml, just very few count, and 3% only he had active sperms. And after 45 days, that is near 45 days, his count also raised and his progressive motility was totally 48.89% and total motility was 84%. So this was an enormous change in 45 days, just from 3% active sperms to 48%, and total motility raised to 84%, and they could naturally conceive with this amount of motile sperms. And the other example is Mr. Pandian. He came to us with just 0% of progressive motility and 99% dead sperm and just 1% of non-progressive motility. So totally he had, it can be a condition called necrospermia. This is not even asthenospermia. When you have more than 50% of immotile sperm, it indicates that they are having necrospermia. So this was his before treatment report, and after treatment, you could see he had total motility of 50% motile and 30% active motile and 20% sluggish motile. So it was a good change within 45 days. So he is another example who improved from necrospermia to normal motile sperms. Okay, and the next patient was Mr. Karthikeyan. You could see his before treatment report. He had a total motility of 6% and rapid motility was 1 and slow motility was 5. So this was his before treatment report. And after treatment, his motility raised to 35%, out of which 25 was rapid and 10% was slow. So this is his after treatment report. Okay. So he also showed a very good improvement. And the next patient, Mr. Jagannathan, he came to us with total motility, progressive motility of 4%, 3% rapid and 1% slow. So this was his before treatment. And after treatment, he had a total motility of 57.57% and the progressive motility alone was 26.38%, just from 4 to 26. So it was a very good improvement in 45 days. And another patient, Mr. Vijay, he had just 9% progressive motility when he came to us for treatment. Okay, and after treatment, there was an enormous change of 34%. from 9 to 34%. So these all reports were just in 45 days changes. So I'm giving you only a few examples. Many other people with such condition have come to our clinic and they have got improvement in 45 days and have naturally conceived. So it is 100% possible through Siddha medicines to cure your asthenospermia. Regarding your response, it might be in 45 days or it might take a bit longer too. But there is a response in Siddha medicines for asthenospermia and there is no need to go for IVF for mere asthenospermic condition. So I hope this video would be helpful for you for your treatments or whatever it is. Thank you so much.